Hello, everyone. I'm Dr. Camille Duran. Before we begin, I'd like to share something that deeply moved me last week. A 64-year-old patient came into my office looking a bit embarrassed. He confided in me that he'd been masturbating regularly since he was 10 and that he still does it. Do you know what he told me, doctor? I sleep better, I have less pain, and honestly, it always does me good. I smiled. You know why? Because in over 15 years of medical practice, I've heard hundreds of similar stories, but many of my patients are too afraid to talk about it. So today, we're going to break the taboos. If you're 70, 80 years old or more, and you have questions about your sexuality, this video is for you. I'm going to share with you what science really says, not what society wants you to believe. And believe me, you're going to be surprised. Stick around until the end, because I'll give you concrete advice you won't find anywhere else. If this video helps you, don't hesitate to give it a thumbs up and subscribe. You can also leave a comment if the topic interests you. All right, let's get started. The first thing I want to clarify right away. Masturbation at 70 years old and beyond isn't abnormal. It's actually very common. Studies show that more than 70% of men over 60 continue to have sexual activity, whether with a partner or solo. So why doesn't anyone talk about it? Because we still live in a society that considers seniors' sexuality embarrassing, even inappropriate. But frankly, that's ridiculous. Let me explain why masturbation can even be beneficial for your health at this age. First, it releases endorphins. You know, those feel-good hormones that reduce stress and improve mood. The 64-year-old patient I mentioned earlier told me that since he retired, he does it every day and sleeps like a baby. That's no coincidence. Orgasm triggers the release of oxytocin and prolactin, two hormones that promote relaxation and sleep. Second, and this has been scientifically proven, sexual activity improves blood circulation. For men with mild cardiovascular issues, maintaining regular sexual activity, even solo, helps keep blood vessels healthy. One of my other patients, in his 70s, told me he stopped his blood pressure medication 4 years ago. Since then, he no longer gets dizzy when climbing stairs. Is it solely thanks to masturbation? No, of course not. He changed his entire lifestyle, but it's part of it. Third, and this is often underestimated, masturbation helps maintain your erectile function. Yes, gentlemen, it's like everything else. If you don't use it, you lose it. Regular erections, even without penetration, oxygenate the penile tissues and keep them elastic. It's exactly like doing gym exercises for your muscles, except this is for your genital apparatus. Now that I've told you all that, you're probably wondering, but Dr. Duran, what changes as we age? Great question. I'm not going to lie. Your body changes, and that's normal. But it's not a catastrophe. Far from it. In men, testosterone levels start to decline toward the end of their 30s or early 40s. This drop is about 1% per year. So at 70 or 80, you naturally have less testosterone than at 30. Testosterone is the hormone that regulates your libido, your sexual desire. With less testosterone, it's normal to have less desire or for your urges to be less intense than before. Some men also notice it takes longer to get an erection, or that their erections are less firm. That's called erectile dysfunction, and it's very common after 60. But beware. Just because it's common doesn't mean it's inevitable. There are plenty of solutions. Sometimes it's simply a matter of blood circulation. With age, blood vessels lose some elasticity, so blood flow to the penis can be reduced. That's why it's important to maintain good lifestyle habits. Stay active, eat healthily, avoid smoking. And then there's the psychological aspect. Many men your age tell me they feel anxious or ashamed about their sexuality. They compare their current performance to their 30s, and of course, they're disappointed. But that's a mistake. You can't compare. At 60 or 80, your sexuality is different. Not necessarily worse, just different. You need to adjust your expectations. Now, let's talk about the risks, because yes, there are a few, but nothing insurmountable. If you have heart problems, you need to be cautious. Sexual arousal, even during masturbation, raises your heart rate and blood pressure. For most people, it's harmless, but if you have severe cardiovascular disease, talk to your doctor. Warning signs are chest pain, dizziness, or shortness of breath during or after sexual activity. If you experience that, see a doctor immediately. If you have arthritis or joint issues, some positions might be uncomfortable. My advice? Use pillows to support your joints. Take your time and be gentle with yourself. There's no competition. Many of you are also on medications for diabetes, hypertension, or depression. Some of these can have side effects on your libido or erectile function. If that's your case, talk to your doctor. They might adjust the dosage or suggest an alternative. Don't stay silent with the problem. Now, let's talk about something less medical but just as important: your mental well-being. Masturbation, or sexual activity in general, isn't just physical. It's also psychological and emotional. As I said, it releases feel-good hormones. It helps fight depression, anxiety, and especially loneliness. Many seniors live alone. Maybe you've lost your spouse. Maybe your friends are less available. Maybe your kids live far away. That loneliness can be very heavy to bear. And masturbation, surprising as it may seem, can be a way to maintain a connection with your own body, to feel alive, to remind yourself that you're still here. But there's a flip side. Many men of your generation grew up with very strict ideas about sexuality. You may have been told that masturbation was wrong, dirty, or a sin. Those beliefs are deeply ingrained and can create shame or guilt. If that's your case, know that those beliefs are outdated. Science is clear. Masturbation is a natural, healthy, and normal activity at any age. If you feel guilty, try talking about it. Not necessarily to your family, but to a trusted friend or a healthcare professional. There are also support groups for seniors where you can discuss these topics freely. Feeling less alone with these questions helps a lot. Another important aspect is social isolation. With age, many things change. You retire, you lose loved ones, your mobility might decrease. All that can leave you feeling isolated, and that isolation directly impacts your sexual health. When you're alone, you have less motivation, less desire. Some men turn to masturbation as an escape, a way to fill the void. That's not necessarily a problem, but be careful not to let it become your only source of pleasure or connection. My advice? Stay socially active. Join clubs, associations, hiking groups, whatever. Maintain contact with others. It nourishes your mind and has a positive impact on your libido too. All right, I sense some of you are thinking, all that's well and good, Dr. Duran, but concretely, what do I do? Excellent. Here are my practical recommendations, the ones I give my patients in the office. First, listen to your body. Don't force it if you don't feel like it. It's okay, there's no quota to meet. But if you do feel like it, go for it without guilt. It's your body, your choice. Second, take your time. At your age, it's normal for arousal to take a bit longer. It's not a sprint, it's a marathon. Create a pleasant atmosphere. Relax. Put on some music if it helps. The important thing is that you're comfortable. Third, use lubricant if needed. With age, skin can become drier and more fragile. A good water or silicone-based lubricant can make the experience much more comfortable. You can buy it at the pharmacy. It's very common. Fourth, do Kegel exercises. Yes, gentlemen, these aren't just for women. Kegel exercises strengthen your pelvic floor, the muscles that support your bladder and rectum. A strong pelvic floor improves your erectile control and increases the intensity of your orgasms. How do you do it? It's simple. Contract the muscles you use to hold in urine. Hold for 5 seconds, then release. Repeat 10 times, 3 times a day. After a few weeks, You'll see the difference. Fifth, monitor your overall health. Your sexuality is directly linked to your general health. If you're overweight, smoke, or drink too much alcohol, it will affect your libido and performance. Eat balanced meals, stay active, get enough sleep. It sounds basic, but it's fundamental. Sixth, and this is crucial, don't hesitate to talk to your doctor. I know it's awkward. Many of my patients say they don't dare bring it up, but believe me, we've seen it all. Your doctor is there to help, not judge. If you have erectile difficulties, if your libido has completely disappeared, if you feel pain, speak up. There are treatments and solutions. Now, let me address a few persistent myths. Myth number 1. At my age, I shouldn't be thinking about that anymore. False. Sexual desire doesn't stop at 60. I have 90-year-old patients who tell me they still have regular sexual relations, with or without a partner. Desire evolves and changes, but it doesn't necessarily disappear. Myth number 2. Masturbation weakens you. I hear this one a lot. No, masturbation doesn't weaken you. On the contrary, as I said, it improves circulation, reduces stress, and helps you sleep. If you feel tired afterward, that's normal. It's the relaxation following orgasm. But it's not weakness, it's muscle release. Myth number 3. If I masturbate, I'm not normal. Once again, false. Masturbation is a normal sexual activity at any age. You're widowed? That's normal. You're in a relationship, but your partner has no libido? That's normal too. You just feel like it, even if you have an available partner? Still normal. There's no absolute rule. Everyone does what suits them. Before wrapping up, I'd like to come back to the importance of communication. If you're in a couple, talk about it with your partner. Many seniors tell me they're afraid to discuss it because they think their spouse will take it badly. But often, it's the silence that creates discomfort. Your partner might have the same questions as you. Opening the dialogue is the key to maintaining a fulfilling, intimate life, even at 60 or 80. And if you're single, don't lock yourself into solitude. As I said, join groups or associations. You're not obligated to seek a new sexual partner, but simply having social interactions does wonders for your morale and boosts your libido. To finish, I want to emphasize one point. Your sexuality belongs to you. No one has the right to tell you what you should or shouldn't do with your body. If masturbation feels good, keep doing it. If you no longer feel the need, that's your choice too. The important thing is that you're at peace with yourself, without shame or guilt. Thanks to advances in medicine, it's entirely possible to have a satisfying sex life even after 60, whether through hormone treatments, medications like Viagra or Cialis, or simply lifestyle adjustments. There are plenty of solutions. Don't stay silent. Talk to your doctor or a sexologist if needed. You have the right to fulfillment at any age. There you have it. I hope this video has helped you see things more clearly. If so, don't forget to like, subscribe, and share it with someone who might find it useful. Leave a comment if you enjoyed it and tell me what topic you'd like me to cover in my next videos. Would you like me to talk about lubricants suitable for seniors? Comfortable positions when you have arthritis? How to discuss sexuality with your doctor without feeling awkward? Let me know in the comments. Take care of yourselves and remember, aging isn't about giving up. It's about adapting. See you soon for another video. Dr. Camille Duran. Goodbye.